treatment of acute cholecystitis. First of all, the first or the initial treatment we have to do is to give the patient the IV fluid and the antibiotics. Okay, we have to resuscitate the patient. Okay, so we give him IV fluid and antibiotic like what? Like piperacillin and tazobactam. Okay, these two are good antibiotics for acute cholecystitis. This is about the initial treatment. What about the next step? What to do? The next step depends on the severity of the acute cholecystitis, whether it is mild or moderate or severe acute cholecystitis. Okay, and we have what we call the Tokyo guideline. The Tokyo guideline provides further recommendations according to the severity of the acute cholecystitis. Now the question is, how does the Tokyo guideline separate the patient according to the severity? Here is the Tokyo guidelines. Okay, here is the grade of the cholecystitis: mild, grade 1; moderate, grade 2; okay, and severe, grade 3. The mild acute cholecystitis is acute cholecystitis that does not meet the criteria for more severe grade. So it is an acute cholecystitis without any signs of moderate or severe cholecystitis. Okay, mild gallbladder inflammation, no organ dysfunction. Okay, now the moderate cholecystitis, the grade 2 acute cholecystitis, how to define it? Okay, we find leukocytosis with white PCs above 18,000 cells per cubic millimeter. Okay, so this is the first one. When you do CBC, you find white PCs more than 18,000 cells per cubic millimeter. Okay, this is the first thing. The second thing is, if you palpate tender mass in the right upper quadrant, then you say, oh, this is a moderate acute cholecystitis. If the pain duration is more than 72 hours, then this is again a moderate cholecystitis. So white PCs, mass in the right upper quadrant, duration above 72. Okay, if we have marked local inflammation, including biliary peritonitis, signs of peritonitis, or pilocholecystitis abscess, or the gangrenous cholecystitis, or emphysematous cholecystitis, anything from these things can indicate moderate cholecystitis. So what about the severe? What is the severe cholecystitis? In the severe cholecystitis, we have multi-organ dysfunction. You can find hypotension, for example, mental status changes, respiratory failure, acute renal failure. So any organ of the other body organs may be affected. If it is affected, then we have severe cholecystitis. So mild cholecystitis, nothing. We have nothing but cholecystitis. Moderate cholecystitis, we have more than 72 hours, a lot of white PCs, palpable tender mass in the right upper quadrant, marked local inflammation, emphysematous abscess, gangrene, etc. Okay, in severe cholecystitis, we have organ failure like kidney failure, CNS, hypotension, mental status changes, respiratory failure, and so on. Now, how is that helpful for us? In the cases of mild and moderate cholecystitis, let's start with the mild cholecystitis. Laparoscopic cholecystectomy is indicated. Okay, early laparoscopic cholecystectomy is indicated. So as soon as we can do the laparoscopic cholecystectomy, we do it in mild cholecystitis. In moderate cholecystitis, it's controversial whether to do early laparoscopic cholecystectomy or late laparoscopic cholecystectomy. And it's important in the cases of moderate cholecystitis that the laparoscopic cholecystectomy is to be done by experienced surgeon. Okay, and if it is difficult to identify the organs by laparoscopic cholecystectomy, open cholecystectomy is indicated. Now, what to do in severe cholecystitis, acute cholecystitis. In severe acute cholecystitis, we can do what we call percutaneous cholecystostomy. Okay, not cholecystectomy, cholecystostomy. Yani we put a stoma in the gallbladder, okay, so that we drain the gallbladder. As you can see, here is a catheter that passes the skin, so it's percutaneous, okay, and then passes through the liver into the gallbladder to drain the gallbladder. This is percutaneous cholecystostomy in severe cases of acute cholecystitis. So in mild and moderate cases, we use cholecystectomy, whether early or delay. Okay, but in severe cholecystitis, first of all, we have to do percutaneous cholecystostomy, not cholecystectomy. So drainage of the gallbladder in this manner almost always allows the acute cholecystitis to be resolved. Then we have to think about definitive treatment like cholecystectomy, okay, or percutaneous stone extraction in the cases if we cannot do cholecystectomy and so on, okay. But the first important thing to do after the initial treatment with IV fluid and antibiotic is to do percutaneous cholecystostomy in severe acute cholecystitis. Now, what is better in the is it early or delay cholecystectomy? Actually, many meta-analysis studies showed that there is no significant difference between early and delay cholecystectomy after 5 weeks of resolving the infection, okay, or the inflammation. I'm sorry. So, but also many meta-analysis studies show that the readmission is less with early cholecystectomy. So this is all about the management of acute cholecystitis. In the next video, I'm going to talk about other complications of the gallbladder stone rather than the acute cholecystitis. I'm going to talk about cholelithiasis, about biliary pancreatitis, and other things. Thank you very much for watching. See you in the next video.